Welcome back. Let's check in with infectious disease specialist Dr. Zain Chagla with the latest developments on vaccines and much, much more. Good morning. Happy Friday.
Happy Friday. Good morning, Bob.
Morning. So as of today, we can mix and match vaccines. Your thoughts on this and how much of a breakthrough is that for us in the vaccination rollout?
Yeah, I think we're getting data suggesting not only is this, an effective strategy in terms of being the same as getting the same dose twice, but there's actually inklings here that this might be even the best strategy. Like the antibody levels from a German study, small study, but looking at people that got AZ and Pfizer, actually seem to be higher than both AZ or Pfizer as the second doses. And add to that, actually, that study looked like even antibodies to the variants seemed quite high too. So, this is great. I think people are willing to take whatever they want for their second shot, but more reassurance that a mixed dose strategy is likely the same, if not a little better than a same dose strategy.
Okay, so the manufacturers are saying that we're going to require a booster shot, but with this, are they just trying to sell shots? Would this replace that or reduce the need for a booster?
I think there's going to be a difference here, right? Again, all these vaccines will do a good job at preventing people from being significantly ill with COVID-19. But we know these variants are circulating. We know there's evolution of this virus, and we probably do need something to help with us getting to the optimal level of immunity. These first shots are going to be profound in terms of what they do to the society, to our population, to our healthcare system. The boosters would be a tweak to boost immunity, to make sure populations that are at risk get higher levels of immunity, and yes, to give some protection against the variants of concern. So, I think we do have these in our future, at least for a couple of years. But again, the best shots right now are the ones coming right now. They're probably going to be the most potent for people because they're the ones that are going to keep them out of hospital.
Now, the providing supplies are good. The mixing and matching should reduce the need for AstraZeneca. It feels like there's been a lot of compromises with those expiring doses. And of course, there were studies supporting it, but the interval was changed, and then the expiry date was extended a month. It just seemed a real stretch.
This vaccine cannot buy a break in Canada, right? And there has been side effects, and I think that's been the big thing, the clotting issue that really altered the rollout here of this vaccine. It served its purpose though, right? The people who feel like they have buyer's remorse, they can get a second dose of AstraZeneca or now can get a second dose of Moderna or Pfizer. But B, I think people never recognize when they didn't end up in hospital, when they didn't end up dying, when they didn't end up getting sick, right? People always complain when things go right and not complain when things go wrong. And so, yeah, it served its purpose. I think, in that third wave, we saw devastation, and the AstraZeneca people weren't represented in healthcare, weren't represented in death, weren't represented in many of the cases. And that's really profound for what it's done.
Yeah, let's talk about the Delta virus that originated in India. How much of a concern is that for you? It is more transmissible, but it's more virulent as well. And doesn't that buck the trend of viruses? When they're more transmissible, aren't they less dangerous typically?
Yeah, we typically see viruses. Viruses' points are to evolve to infect more people, right? That is their goal, right? The virulence of being in more symptoms or less symptoms is a bystander of how our body deals with it. They're not necessarily going to change. As long as the virus can infect me and infect someone else, it's served its purpose. And that's really what the evolutions are for.
Yeah. Before we go.
So, I think there's
Yeah. Oh, sorry. Before we go, I just wanted to ask you something we had in the news this morning. The WHO is saying that vaccinating kids is a low priority. Is Canada being selfish by vaccinating our kids 12 and up and not donating those doses?
I've been, vocal about this. There's an op-ed in the National Post I wrote yesterday. Yeah, I think that we are going to be okay from Delta virus because of our vaccine strategy for adults. The world will not. There will be millions of lives lost. And we have to really think about how we place vaccines in this world because there are going to be kids without parents. There are going to be health systems that are collapsed. There are going to be kids that are going to be left worse off than better. And right now is not the time to start going deep into our population when there is such a vulnerable global population out there.
Yeah, and the global problem is our problem. Hey, thanks so much. We'll see you again next Friday. Infectious disease specialist, Dr. Zain Chagla. Have a great weekend.